Ladies and gentlemen, dear colleagues, I'm Christoph Diener from the Faculty of Medicine at the University of Duisburg-Essen, and I wanted to report new studies which were published in October 2022. The most important and the most relevant studies were published in the stroke field. Two studies from China which clearly showed that thrombectomy is effective in occlusion of the basilar artery. The first study was the attention study in 340 patients with occlusion of the basilar artery, and they were randomized in a proportion of 2:1 to thrombectomy or best medical treatment. Time window 12 hours, about a third received systemic thrombolysis. The primary endpoint was modified ranking scale from 0 to 3, which was achieved in 46% with thrombectomy and 23% with best medical treatment. Mortality after 90 days was dramatically reduced from 55% to 37% with thrombectomy, about 5 intracranial hemorrhages in the thrombectomy group. The second study, also done in China, recruited 217 patients with occlusion of the basilar artery. Here the time window was 6 to 24 hours. 20% received thrombolysis, again primary endpoint, modified ranking 0 to 3. This was achieved in 46% with thrombectomy versus 24% with best medical treatment. Mortality after 90 days, 31% with thrombectomy versus 42% with best medical treatment. 6 symptomatic intracranial hemorrhage versus 1. So we have two studies which clearly show that in a time window up to 24 hours, thrombectomy is effective in occlusion of the basilar artery, improves functional outcome, and reduces mortality with a very small risk of intracerebral hemorrhage. The caveat is these studies were done in Chinese patients and not in Caucasians. And these patients, much more frequently than Caucasians, have a pre-existing stenosis of the basilar artery. So many of them required balloon dilatation and stent implantation before thrombectomy. But I think there is no doubt now that thrombectomy is effective. The second study from the Netherlands investigated whether it makes sense to increase blood pressure in people who have a suspicion of stroke on the way to the hospital. So they asked paramedics to apply either a patch with glycerin trinitrate, 5 milligrams, or placebo on the way to the hospital. And they recruited 380 patients, and this study had to be terminated prematurely because, number one, there was no benefit on the modified ranking scale, and there was a significant bleeding risk in the active treatment group. And this clearly shows that lowering blood pressure on the way to the hospital or early on in the hospital in patients with ischemic stroke has no benefit. Let me move to prevention of migraine with monoclonal antibodies. We have now monoclonal antibodies like erenumab, which acts as a CGRP receptor, or other ones like fremanezumab, galcanezumab, and eptinezumab. A study group in the Netherlands investigated whether the treatment with monoclonal antibodies has an impact on blood pressure. So they prospectively followed 109 patients on erenumab 140 milligrams and 87 patients on fremanezumab 225 milligrams over a period of 12 months. In erenumab, they could show a significant increase in blood pressure by about 5 millimeters mercury, which they did not see in fremanezumab and not in controls who were not treated with monoclonal antibodies. But the good news is that only 3 patients on erenumab needed antihypertensive treatment. So the bottom line is, please measure blood pressure sometimes in patients who have migraine prevention with monoclonal antibodies. Another study in Denmark is very important because they investigated whether erenumab 140 milligrams works in trigeminal neuralgia. They randomized 80 patients to erenumab 140 milligrams or placebo, and there was no benefit of erenumab. And this shows that obviously release of CGRP plays no role in trigeminal neuralgia. And the last study was a study with intravenous immunoglobulins, 2 grams per kilogram body weight, in 95 patients with dermatomyositis. And they were treated every 4 weeks for 16 weeks, and there is no surprise that the immunoglobulins in 80% of the patients improved the condition compared to 44% on placebo. But the caveat here is immunoglobulins can have side effects, and 6 patients in the active treatment group had a thromboembolic event. Ladies and gentlemen, some interesting studies in October 2022. The most exciting one and the most relevant ones for clinical practice is that thrombectomy is highly effective in patients with basilar thrombosis up to a time window of 24 hours. I'm Christoph Diener from the University of Duisburg-Essen. Thank you very much for listening, and thank you very much for watching.